It's been over a year since President Barack Obama signed into law the Veterans Access, Choice, and Accountability Act. The law directed a new program to be established to better serve the health care needs of the nation's veterans. Today, the Veterans Choice program is now in place, but in Oklahoma and elsewhere, it has had a rough start, leaving many veterans without the health care they need in a timely manner. Combat war veteran Ann Marroquin was surprised when she became pregnant with her fourth child.
When I found out I was pregnant, it was 20 weeks, and I needed to get in ASAP to get prenatal for the baby, and I wasn't able to.
Marroquin was confused because getting prenatal care for her third child was a breeze.
This time I had to fight them. I was like, can I get an appointment? Who do I need to contact?
With her fourth child, Marroquin was directed to use the Veterans Choice program for setting up an OB/GYN appointment. Tri-West Healthcare Alliance, located in Phoenix, Arizona, is contracted by the federal government to administer the Veterans Choice program.
The people that do answer the phones don't work for the VA, so they don't understand. And so I called 3 days later, and I was like, I haven't gotten my appointment. And they said, well, ma'am, if you just quit calling so much, maybe we can get this done faster. And so I was like, excuse me, you're talking to a veteran that needs health care, because I was 24 weeks pregnant by then.
She didn't get in to see a doctor until a month later when she was 7 months pregnant. Stacy Williams is the program application specialist with the Muskogee Veterans Medical Center.
It rolled out so fast, and I know there's a lot of kinks and a lot of frustration with it, but I can also see, and we hear on our weekly calls, they're advocating and they're working diligently to get some of those things changed.
Williams says Veterans Choice allows vets to schedule an appointment with a doctor outside of the VA if the wait to be seen is longer than 30 days or if the closest veterans clinic is more than 40 miles from where the veteran lives.
People who live really far from a VA medical center, such as Hugo, or even as far as close as Bartlesville to Tulsa, but they're still an hour drive, they're able to see somebody locally without having to wait and also without having to drive.
Morton Comprehensive Health System has satellite clinics in Bartlesville and Nowata, in addition to 3 Tulsa clinics. Morton applied for and has been approved as a Veterans Choice site for primary care. Dr. Laura Dempsey-Poland is Morton's Vice President of Community Involvement. She says behavioral health needs can also be met.
Well, let's say that someone is really having an anxious day and they're having difficulty coping through the day. We can see them with a pre-authorization again in our behavioral health setting, and we just have to make that appointment and get them in right away so that they can sit down and talk to a counselor and work through things.
Dr. Dempsey-Poland says they're just getting the program started, but she was assured getting pre-authorization from Tri-West would be no problem. As part of his job with the Community Service Council of Tulsa, Jim Lyle oversees the integration of services for military veterans.
The early report is that the application process is complicated and it's slow to evolve.
For me particularly, no, it has not worked well.
Veteran T-Bone Massey says the VA doesn't have a specialist that can address his skin condition. Massey hoped Veterans Choice would allow him to see a private doctor with the expertise needed.
They sent me to a private doctor, but at times then they have to approve each time I see the doctor if it's worthy enough for them to spend any kind of money. And some of the treatments I need, right now the VA is not going for it.
And he says the wait time for his authorizations have been too long.
Sometimes it'll take a month to 2 months between appointments. And now it's to the point that, he's not really wanting to see me anymore because the VA is really not wanting to cover the payments.
But Massey does say some veterans have been satisfied with Veterans Choice. Stacy Williams says in the last year her office has sent private care authorizations for 10,000 veterans whose wait times have been more than 30 days. Lyle says the VA is moving in the right direction to better serve veterans, but that it still has a long way to go.
They have a unique need to address female veterans. The last I heard, our local VA was treating over 1,000 female veterans.
And with the end of many deployments, the VA is becoming responsible for the well-being of more veterans each day.
We are seeing an increase in veterans coming in to be enrolled with the VA system. In the past 2 years, we've had about a 5.5% increase. So they are coming out. We're getting more female veterans.